Hello there, I'm Miranda Gretton, and this is Take a Moment with NCHC, the show where we talk to you and your colleagues about experiences that affect you. Listen on your drive between patients or in your downtime, whenever you get the chance to take a moment.
I'm Lianne Thompson. I'm a community nurse, but I'm currently doing my district nurse degree, postgraduate diploma, and I'm based in the community within NN4 at the moment.
Hi, my name's Laura. I'm a registered nurse. I currently work in the community within the matron service, but I've been seconded to the University of Suffolk to do the specialist district nursing course in practice.
Hi, I'm Rosy Watson. I'm a quality matron in the North. I was seconded out between January 2021 to December 2021 to complete the postgraduate diploma in district nursing.
So we've got Laura and Lianne who are doing the course and Rosie who's already done it. So we're here to really talk about the course and what it is and what it can give people. But I have to confess, and I said this to Lianne before we started recording, that I actually thought that district nursing was what we used to call community nursing back in the day. I didn't actually realise that it was a separate qualification. I wonder whether other people are the same and didn't realise. So could you give us a bit of a background or sort of a bit of an understanding of what the course is and what you're learning and that difference between the two?
I think you're not alone in that thinking. I think the majority of people think that community nurse and a district nurse is an interchangeable term. You often hear even the GPs referring to the district nurses or the district nursing team, but to be a district nurse, you have to have an enhanced qualification, which is a postgraduate diploma. So you have to have been working within the community for 3 years before you can apply to do that. And you can either do it part-time or full-time. We're lucky enough to be in a situation where we've been seconded by the trust to do it as a full-time 1-year course in which you get to do a little bit of research and background in district nursing, and we do a module which is an assessment module, holistic assessment module, and we do our non-medical prescribing within that as well, so we come out at the end of it as a prescriber.
So Laura, what was your journey to this? What made you want to do this secondment?
Well, I've worked in the community for about the last 6 years. Before that, I worked in the acute setting. But I think I just wanted to enhance my skills and get a deeper understanding of not only, district nursing in itself, but of the community healthcare and join the dots up with that. I think just to echo what Lianne said as well, it's really important because we do the clinical assessment skills and the V300, which is the prescribing module. And what we can do after we've got those is actually practice at an advanced level. So that improves continuity of care for patients. And also, when you're working in quite a rural area, you can sort of provide a one-stop shop really, rather than having to go backwards and forwards to GPs and things like that.
Interesting. And how are you finding the course? How far in are you?
So we are about 3/4 of the way through. We finish in March 2023. It's been a steep learning curve, but it has been valuable, and I've learned a lot of really valuable skills, and not just in terms of the practical and the clinical skills, but in terms of leadership, because I hadn't been in a substantive leadership post beforehand. And it does teach you a lot about leadership and about applying evidence-based to practice, which I think, creates more of an advanced application of skill.
Lianne, is it what you were expecting?
Well, obviously it's at a level 7, so it is academically quite challenging. I think I kind of expected it to be more difficult from a placement level, because as a pre-reg student, often it's quite difficult to get what you need out of the placement. However, I found that I've been really, really well supported within my clinical placement areas, and have been able to do lots of shadowing and be open to having lots of clinical supervision really, which has been really good. We've been given a lot of time to make our own choices about our areas of learning. So because it's at level 7, it's much more about what we need to learn and what we need to get out of it. So that's been a really interesting and different way of doing it to when we were pre-reg and everything was much more structured. I've just recently applied for a new job, so I've got a new job for when I complete the course, and because of the skills that I've gained during the course, they're actually happy to wait for me to complete it, for me to take on the post. So already I feel like it's definitely benefited me in my career going forward.
Is it still within the trust?
Yeah. So I've
Yeah.
been given a position within the trust. So and it is it's going up a banding and then being given a bit more responsibility, and that is purely because of the skills that I've gained from doing the course. So yeah, I can already see the benefits of it.
Laura, why choose this district nursing course over something else, like an apprenticeship doing something else or some other kind of clinical education route? What was it about the district nursing one that made you want to do it?
I think, first of all, it's the most applicable to the role that we're all, where we work at the moment, and the setting, the community nursing sort of setting and the community healthcare. But also, it's just that consolidation of learning, where I liked the look of the course and the structure of the course, because you get a bit of everything in there with your clinical skills, your prescribing, a bit about research, leadership, policies, procedures, at a national level. It encompasses everything, and it actually opens doors to other things. It doesn't have to just be confined to district nursing in the future if you don't want it to be. Of course you can, but if you want to then maybe do, for example, what Rosy has done and go into quality, or you want to go into management, or you want to go and practice at an advanced level, as a prescriber, then all these things are possible. So it's a good springboard.
We get that from university perspective. They tell us all the time, it's not just about completing the course and becoming a district nurse, it's about growing the person in the direction that you want to develop within.
Rosie, I'm interested to hear from your perspective. So did you do the course with the view to getting a particular role, or and the role that you're in now, has that been something that you didn't ever expect to come into?
So yes, so I knew right from the beginning of my career that community was where my passion was and that that's where I wanted to be. So in the role that I'm in now within the quality team, I'm getting the opportunities to influence the way that practice is being delivered and that care is being delivered, and being able to actually make the changes for populations and to be able to support the workforce to deliver the best care. That has been because I'm able to articulate what we need confidently and being able to say that this is what the evidence says, and be able to be critical of the evidence as well. And those are all the skills that I've learned from the course.
So far, from your perspective, Lianne and Laura, what's been your favourite part of the course? What have you enjoyed the most?
I'm much more of a hands-on practical nurse than I am academic, and I really enjoyed going into greater depth about the systems of the body and how they function and the things that we should be looking for. As a palliative care nurse, it's very much about emission avoidance and symptom management. So from a assessment point of view, we're also looking at a bigger picture of your reversible causes and all things like that. So taking it as a much wider outlook. So yeah, that was definitely my most interesting part.
One of them is the same as Leanne's, learning about the body, learning about, top to toe clinical assessment, how we can sort of offer differential diagnoses, and we can question ourselves, and also with enhanced skills get the right outcome for the patient. But the other thing that I've really enjoyed is going through the journey with our course mates, the people that we've met on the course. I felt that we've been a really close team and a tight-knit team, and we've all supported one another. We've shown good collaborative team working, which is obviously really important in healthcare, even though we are doing it via a university course. I think we've all worked really well collaboratively and pulled ideas and supported one another and helped one another. So that's been really good.
Rosie, are you still in touch with anyone that you were on the course with? Like, does what Laura's talking about continue when you finish the course?
Yeah, absolutely. We called our district nursing WhatsApp group the District Nursing Family, and they are like family. We arrange an annual meetup and we absolutely stay in touch. It wouldn't be an over exaggeration to say that you are literally stripped down to your naked self during the course. And so, you know, your peers, your student colleagues see you at your lowest point. And when you've got those relationships, they see you at your lowest point, but they pick you back up as well. I absolutely hear what Laura's saying about the collaborative approach. It's incredible.
Lianne, are you finding that? Are you okay?
It's funny, isn't it? Like,
Oh,
I didn't.
bless Lianne, she's upset.
Oh, Lianne. What was it about what Rosie said that made you upset?
I think it's the realization that other people understand the pressure of it and the importance of it, and like the pressure that we put on ourselves, and you know, to get through it and to get to where we are, and to have them enhanced skills, especially as someone who, you know, we've all got lives and families and dyslexia or whatever other challenges we might have, and it's not an easy thing to do, and I mean the support that I've had from the girls throughout this course has really been invaluable to me, and it is, I do think it will be a lifelong connection, and I think that's really lovely to hear from Rosie's point of view, that she, you know, had the same from her cohorts.
You know, as well, we haven't just supported each other with the work and the course, like, you know, like what Lianne said, we've all got things going on outside of it, and the course, although it's very valuable in some ways, it is a massive commitment, and you know, it takes up a lot of time. So you need to have that level of support there to try and manage and juggle things.
It's interesting to talk about this actually, because I think a lot of people would be put off by doing something that takes a year, is a huge commitment, is a lot of work, is very tiring, you know, and all that kind of stuff. But actually, what you're talking about here, that a lot of the benefits in terms of your job and your career progression, but actually personally, just having that support network and just knowing that you've got a group of people who have your back, like that's a huge thing.
So for me, when I joined the course, I was a diploma nurse, and so I had to submit a portfolio with academic writing to demonstrate that I could manage with the academic level of going from diploma level up to postgraduate, so level 7. And so for me, there was a lot of personal pressure, that I felt that even though I was a diploma nurse, I was still entitled to be able to be on this course, and that I had qualities to offer. And the other thing is that in my late 30s, it's okay that I'm going back to uni and that I'm still a student, that maybe from my academic ability, it was just a bit delayed. And that I just took a little while to bloom. And that's okay, because, you know, life is long and your career is long, and we need to seek out the opportunities to make it interesting. And I've certainly done that.
I think, just to sort of echo what Rosie said, I was a diploma nurse as well. And when I qualified, you could do a top up, which I sort of started doing, but then they changed it again and they weren't doing the top up at degree level anymore. So I was the same as Rosie, where I went in from having done a diploma in like 2011 to 2014, and then not really having done much apart from a couple of modules in between that, to then going to study at master's level. You know, my academic capabilities have had to be brushed up on.
Does it give you those kind of academic skills?
It does, and I think as well, you know, I will openly hold my hands up. I'm no means the brightest in the room, but I think if you're organised and you access support and you utilise the study skills, it is achievable. You don't have to be somebody that's a genius to sit there and do it. Don't be put off by it, because you can get the help.
Absolutely. And the university they certainly gave me a lot of support from student skills, and I'm still using those skills.
If anyone's listening to this and they're thinking that they like the sound of this course, what would be your advice?
I would say it's a really good opportunity. I would say to go for it, as you learn a lot personally and professionally, and utilise all the support on offer from your employer and your university. But one thing I would say, if you are somebody that maybe has got a lot going on in your personal life during that year, whether you're getting married or you started a brand new hobby that you do every night, it's probably best to maybe leave it until you've got a little bit more free time to commit, rather than juggling lots of plates.
I mean, yeah. Yeah, it's definitely that. It's a juggling act, and we all have stuff going on, whether it was planned or not. But it's juggling lots of things, trying to keep them all up in the air throughout the year, and I think that it definitely takes a lot of commitment to be able to get to do that. However, I wouldn't be in the position that I'm going to be coming out of it if I hadn't have done the course. So from that perspective, I'm really, really pleased that I have done it, and would obviously recommend it to anyone who wants to develop their career.
So when I started the course, I had conversations with all the key people around us and said, look, this is what the course is going to be. It is going to be full on. I know it's going to be full on, and it's only going to be a year. And so we just need to brace and know that the expectations of a great big family holiday or nice weekends is going to be reduced, but it's only a year. And I did it, and everybody survived, and now we're reaping the benefits from it. And I will continue to, and I'll continue to be extremely proud of what I achieved in that time.
Short-term sacrifice for a long-term gain.
Exactly,
That's
Lianne. And one thing that I would just say, if people are listening out there, because I'm sure Lianne and Rosy will both appreciate this: organisation, organisation, organisation. Get yourself a planner, get yourself a diary, put up some bits and bobs in your kitchen or whatever you want to do with it. Make sure you're organised and you're starting things within enough time, because if you leave it and leave it and leave it and let it build up, you'll get yourself in a muddle. So you want to make sure you're doing it in advance.
You need to find some coping strategies. You need to find out where is best to get your downtime. And so Laura and Lianne have just finished their research. Now, the research module was really, really challenging for me. I did not particularly enjoy it. Yeah, the cognitive demands for the research was tricky. So what I found I was doing was working for 2 hours, and then I would go wild swimming. Even though it was not necessarily working, it was giving my brain a rest. And we talk about active rest, don't we? And so it gave me an opportunity to just be quiet and to let my brain catch up with thinking. It worked. I passed.
I think rest days are hugely underestimated. I think we think that we have to be busy, 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 go, 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 and you have to do work, work, work to get to as that's how you learn. But actually, when you're resting, you're thinking, you're digesting, and you start to look at things differently, have different perspectives. And if you don't have that time, you'll just burn out. I think it's so important to factor those days in. This is such good advice.
Myself and Laura rest at different points. So Laura gets it done and then rests, and I rest and then panic and get it done at the end.
All of us that are on the course, we're all we're different people that deal with things differently. It's what suits you, and you should do what's going to cause you the least amount of stress, basically. And my way of doing that is planning everything in advance, and various other things, but everybody's different.
There is a huge amount of support, and the benefits for you personally and professionally are huge. And I think that's the takeaway from this conversation, isn't it?
Absolutely.
I think the other thing is that doing this course with NCH&C support, my experience, in my opinion, was better than the other students. That I only had to do light knocks on doors, and doors were opening for me. Senior management were able to support me. Senior management were giving me opportunities, inviting me to join in things to get me those experiences that I needed for my journey. NCH&C have seen the value and hopefully are appreciating the investment.
Thank you for listening to Take a Moment with NCHC. If you've enjoyed this podcast, please visit the podcast intranet page to leave a comment and for details of our other episodes. You can also follow NCHC on all social media channels.